Good afternoon, and thank you to SAGES and the SAGES Governing Board, and of course, our panel chairs. My name is Todd Bartos. I am an attorney in Pennsylvania, and I've had the privilege of working with physicians and surgeons throughout the country for more than 20 years now. Those of you who know me know I grew up in a medical family and ultimately went to law school, maybe the black sheep for a little while, but then working with, not against, the healthcare system kind of put me back in the good graces. So again, I appreciate everyone watching this and interacting with it sort of in the new COVID environment. There are a lot of changes, a lot of challenges out there, and we're going to be reviewing some of them here today. The medical legal rules of engagement are changing. They are changing day after day after day as more and more information about COVID comes out, as places reopen, elective surgeries start, places close, elective surgeries cease. Your patient relationships are being strained. There's new ways of interacting with patients. We'll talk about that. And the Facebook collaborative that SAGES has spearheaded for internal discussions and collaboration between surgeons has now transcended and almost become a way of communicating to the patients as well and using technology. So we'll talk about that as well. I have nothing to disclose on this matter. One of the things, of course, that is always in the background as we talk about and look at how the internet and technology has changed the patient relationship, of course, is whether people are looking to Facebook or Google or other online sources for information, chat rooms. You can see it now in what's being forwarded and put into the major media regarding COVID vaccines, treatments. It's kind of been laid bare a little bit. So, first thing I want to talk about today is what's kind of happening out there. How is what's happening in the world going to affect you and your practices and your relationships with your patients? Then we're going to talk about what are they up to? And by they, I mean the plaintiffs' lawyers, because they are not processing cases right now. There are fewer intakes because of this lull. And most importantly, most courts around the country, other than federal courts, have largely shut down. So they push things off months and months and months. And so plaintiffs' lawyers are sitting at home looking at how do we come out of this stronger and with a larger case volume. And then finally, I'm going to talk about some weapons that you have in your arsenal and the rules of engagement and patient relationships in the post-COVID era. So what is happening out there? What's happening with your patients? What's happening with your practices? More people are online more often than ever before. That is a sea change, even in a technologically savvy world. People have access to more and more information. The Facebook collaboratives are an incredible effort and a great way to share information. Of course, be careful what you share, be careful with how you present. Your patients are out there in the ether, if you will, on the internet. So you don't know, even though they're closed groups, is information that's conveyed in those groups presented publicly. So again, just be careful more than anything else about what you post, what you discuss. These internal discussions, although we think of them as M&M and we think of them as educational, there is always the risk that a skilled plaintiff's lawyer will ask about that information, ask about whether you've shared it with colleagues. And if that becomes discoverable, you want to make sure that you have not in any way committed any HIPAA violations, privacy violations, or things of that nature. And finally, telehealth. Telehealth has been a massive game changer lately in terms of how people are interacting with care providers. Pre-op, post-op is going to be an issue. Telehealth is the bridge to a new type of consult. Question is that a good thing? Don't know yet. Sometimes for some patients, it's an excellent way of maintaining communication. For other patients, it's a terrible way. because we're not able to be there and see the full body language if we only get a face. So it's kind of an interesting Hobbesian choice. So you can have them in your office wearing a mask and you don't get the facial cues you would normally get, or you have them remote and they're not wearing a mask, but now you're not able to see the full body language. So again, there's no perfect solution, but it's all about understanding what the risks and limitations of various technologies are and what certain choices are, and making those intelligent choices about how do you get people together and how do you get patients together. The other thing that telehealth is changing, and this has been something that's been discussed for years and is finally starting to happen as bandwidth catches up, is not only do we have remote consults, but we now have remote surgery. And there have been some demonstrations of it and using robots, but here for the first time, and it was a case report in the Annals of Internal Medicine, July 14th, a robotic vocal cord telesurgery. So they were able to manipulate the instrumentation remotely using 5G networks. The use of technology in healthcare is only going to grow. The House of Representatives federally has moved to make the changes to Medicare reimbursement related to telehealth permanent. And again, that was through a bill that was introduced July 16th. You can find out a lot more about it as you need to. So let's talk about finally the last piece before we get into your arsenal, if you will, of weapons that you can use as we look at these new rules of engagement. Plaintiffs' lawyers are out there, they're thinking of new cases. If you were to just even search, they're talking about COVID-19 misdiagnosis as a large area for cases. They're talking about surgical malpractice, not have you breached a standard of care, but how have you kept your skills sharp? No pun intended. The important part of that is, what are you doing to re-onboard? Are there cases? Are you looking at how you're ordering your cases? Are you maintaining your skills while you are out of the OR? There are also going to be more and more cases regarding charting errors. There's one law firm that I've been following that is looking at creating a practice based on ICD-10 misdiagnoses. So if the ICD-10 code is incorrect and that gets carried forward and leads to a misdiagnosis, they're going to try to pull other people into that lawsuit. Again, it's about more people to the table. Why are they doing this? Because they've had a good run and they want to keep it going. Aon and Ashram reports recently have, in 2019 cases, and 2019 data have shown that the average cost of a case, so that's defense costs and indemnity or payments, has increased 50% since 2009. And that's a staggering number. What's driving a lot of that, of course, you have jurors and juries who are being more generous. And I think that trend in a post-COVID world will sadly continue, that there will be testimony and evidence of how the pandemic has affected people, how it has affected their work. That's going to spill over, and there's going to be a re-equalization effort. And again, plaintiffs' lawyers use great techniques on this, using our psychology against us, the reptilian brain, things I've talked about before. And I'm happy to talk to you about offline as well. Feel free to reach out to me directly. Be happy to run through that with you. Payouts over 5 million, so-called super verdicts, have increased sharply since 2015. What do I mean by sharply? They've gone from under 1% of all cases to 1.2% in 2015 to 1.9% in 2019. So we're getting close to doubling the number of cases that are super verdicts. And that's even in states with tort reform. So for example, in California with MICRA, one of the areas that they're really focusing on is medical battery. So for example, if there's a surgical error, normally there's a cap on non-economic damages. However, they are circumventing that by saying medical battery isn't covered by MICRA, and therefore when you commit malpractice, you're actually committing two different torts. And there have been some cases where that has been awarded and multiple millions of dollars have been awarded. What is not clear is whether those damages are covered by your insurance or not. And that is an open issue that we continue to research. The last thing that's creating an interesting situation is the rise of employed physicians has now driven a hardening of the malpractice premium market. So we're seeing rates increase substantially over the last few years and will continue to increase because employed physicians are pulled out of the private market. They're put into risk pools that are owned by the healthcare system. And so there are fewer and fewer physicians to spread these losses over. And so rates are increasing. Again, that is a trend that we have not seen in over 10 years. So what are some of the good things that we can do? I want to talk today briefly about 4 areas and sort of the rules of engagement center around these 4 areas. And some of them will look very familiar. Some of them you're going to go, that's a new thing. I haven't heard of that. Again, very brief overview. Happy to talk to anyone offline about some of these issues, and feel free to reach out to me directly. So safety culture, are you able to lead by example? The communication protocols that we're using, we need to step it up another level, and I'll talk about tactical empathy in a moment. Teamwork, what is a team? How do we make it meaningful? And then are we disclosing? We've been talking about it for 15 years now. Are we doing enough to disclose? Have we baked it in enough to education, to training, to finding the right people? So patient relationships matter more than ever. I'm going to pause and I'm going to say that again. Patient relationships matter more than ever. As surgeons, you don't have the same issues as primary care necessarily with not establishing a primary care physician, and we're seeing that in the millennial and the digital generation, but you still have to address the issue because telehealth is king or queen. Telehealth in the post-COVID era is here to stay. And so we're going to need to develop new communication strategies, new culture strategies, new interaction strategies, new processes, new forms to properly collaborate through telehealth, but also make sure that we continue to put the responsibility on the patient to be truthful, honest, forthright, and to do what he or she needs to do. Again, that's an important concept, and we don't focus on that enough. Making the patients appropriately accountable. So safety's been a buzzword for a while. Have we been serious about implementing it? Some have, some haven't. There's been kickoffs, and then it kind of falls by the wayside. Candidly, the last 4 months, if you haven't been talking about PPE or COVID, this really hasn't gotten much attention or much oxygen at the higher levels. That's going to start to change. What do we need to do differently to develop a safety culture in the post-COVID era? And does it now include safety from COVID itself? So there are some liability pieces in different legislation, but ultimately, what obligation do we have to either test ourselves, test our team members, test our staff, to make sure that our patients who, if they're post-op or even pre-op sometimes, are in a diminished capacity in terms of immune function, to make sure that they are protected. So developing that safety culture, refining that safety culture for the post-COVID era is critical. Communication comes in many forms. Written, literally written text, documents. There's also text messages, iMessages. We're used to this type of communication now, WhatsApp messages. There's oral communication, that's being challenged by masks. You put a mask on, it gets to be a little bit unclear as to what people are saying, how they're saying it. Now, as surgeons, you're good at reading people's faces with masks, so that helps, but your patients aren't good at reading that. So things that you may think are using humor, you just have to be mindful that it's a different way of communication and building that relationship. There's COVID modified body language. The newest tool to deploy is tactical empathy. Now, this has been a concept that really has been around for a number of years in a variety of areas, but has not been used in healthcare. And tactical empathy is being aware of and using your patient's communication style to mirror them, to reflect on them, to draw out information through certain key words, certain buzz phrases. Now, it's beyond the scope of today. It's a separate, workshop on that, but that is a new term that you will be hearing more about in healthcare and in communication. How do we use psychology to continue to develop and build strong bridges between us and our patients in this post-COVID world? Tactical empathy is a critical success factor there. Teamwork is also more critical than ever, but also defining what a team is becoming more challenging. Is it just your office and your office staff? What about in the hospital? Who are the teams? How do we identify the teams? What about in the OR? Who's on the team? There are cases now where it may be there's one recently that went to verdict where it was an anesthesia and a propofol issue, but the surgeon was still held partially liable. The surgeon got dragged into that. So how are we developing that team among everyone in the OR? What about in the PACU, developing that team and that culture? And then finally, telehealth. What's the team for telehealth? Is IT part of the team? They should be, because they're the ones setting up your infrastructure. So you want to have an eye on what teams are and what it means to be a team and how to work collaboratively and how to engraft the patient into that team. Not all the time, but at the right time and for the right reason. Sometimes that team is going to include the patient for a disclosure discussion. And that's the last piece that we really need to focus on in 2020, 2021 is the disclosure movement. We've talked about it for years. Some have implemented it. Some have pushed it by the wayside. I'm fortunate enough to be on the board of Sorry Works. As an example, that grew out of a medical error that wasn't disclosed. And we are finding still more and more situations where medical errors not being disclosed lead to lawsuits. And it is striking at times because I hear from my clients, well, I told them what happened. And then we go through and it's like, well, did you tell them? What did you tell them? How did you tell them? So disclosure needs to be a process, and we just need to continue to implement that process. It is expected more and more. Opening up, being honest, being forthright about it, and it's the right thing to do. And trust me, it plays well in court to your advantage. So those are the main rules of engagement for 2020. On the Facebook collaborative side of things, again, continue to use those opportunities to work with colleagues, practice these skills, talk about teamwork, and really look at how do we augment our toolkit even further as we get into 2021, 2022. And finally, I know a lot of you have been pulled into multiple directions during this challenging time. Personally, and on behalf of my family and my colleagues, I just want to say thank you for the fact that you've put yourselves on the front lines, you put yourself at risk. A couple of my neighbors who have not been doing any pulmonary or critical care because they're subspecialists in surgical disciplines have been pulled into pulmonary and critical care in their hospitals. And I know there's a learning curve there, but I want to again say thank you for everything you're doing. Your patients will appreciate it. Let's take advantage of that goodwill that we're building and allow it to transcend how we interact with and partner with patients as we go forward in the post-COVID era. Thank you very much. Appreciate your time. And again, if you want to email me, my contact information should be in the handout, or just email me at Todd, T-O-D-D, at tbg-llc.com. Have a great day. Thank you.